Florida, Illinois, coming to this area or surrounding area, and then traveling within that region. As we've been told, and we know that the science bears it out, that social distancing and traveling is not recommended. Social distancing is, traveling is not, especially if you're ill. But what we can see here is that we are surrounded by COVID-19 in pretty large numbers in all the states that surround us, including those states that you can't see on the map, but obviously we have folks who are coming in here for various reasons. Actually, on the way in, I just saw somebody with a just married sign on the back of their car with an out-of-state plate. So I know it's happening. We've had reports of it happening, and people are apparently moving into our area temporarily to avoid these other areas of higher spread, which brings the risk to us to some extent. The other thing I want to take a minute to talk about is in this area, we have a certain number of hospitals and a certain number of healthcare providers. The hospital setting is such that if you look at this being a picture of a river or a series of rivers, and the Asheville area being a catch basin, as the hospital in Mission, or at Mission, becomes more full with individuals who are ill, they can't receive more individuals from the hospitals that are extended out in the other counties that surround Asheville and who are part of the HCA and other healthcare systems. So if you look at that as a catch basin, as the Mission system gets full, it will back the rest of the systems or the rest of the tributaries and streams up. And that means the folks in other hospitals upstream, such as ours, will have less of an opportunity to transfer patients who are ill to the catch basin or Mission. That's a concern. And when you don't have beds and rooms available to isolate or ventilators to take care of folks, and you have nothing else, no other place to go, we have a healthcare crisis. As far as tests go, I wanted to show you that here are the different testing done by various states, with 667 in Tennessee with 2 deaths, and in Georgia the 1247 with 40 deaths at the bottom, you can see that, and then 608 with 2 deaths in North Carolina, and then 142 with 7 deaths. And the reason South Carolina has fewer tests is that they only use state-provided tests. They don't use private labs. So that's why that number is beginning to be slower, or lower, I should say. So these are the number, I should say, of the cases in those counties, in those states. The tests that have been completed, you can see Tennessee, large number, Georgia and North Carolina coming up with over 10,000, and then South Carolina again, because we're using state tests. This regional picture, you'll see the map on the right shows us different regions in our state, mostly in the west. Region 1 is where we're found, 2 and 3. If you look at the graph here, this line, green line going pretty high up, is the state. And if you look at the other 2, region 1 is us, and that's down here with a fairly lower number, and then region 2 is slightly higher and going up. I would just also like to say that in the testing that we are doing, we first test to see if people have flu before we test for COVID-19. And the flu is showing up in our testing. Flu is not out of the normal possibility in this region. So flu could also be a problem for folks, especially if they didn't get a flu shot. And we're trying to screen out flu first before we use COVID-19 tests. This is what Macon County looks like as far as our testing. We started on the 11th and have progressed since then. The blue are the tests as far as the negative tests. If you see, oops, that looks good. All right, if you see the green, those are flu tests at the bottom. And then you have the COVID-19 tests that are pending, either at LabCorp or the state. So our biggest day was the 16th, and then we've had steady numbers of tests that we've been doing since. We are still waiting for several of the test results to come back, and we feel like we still have some time before we'll see the rest of the picture pan out. But as of this date, we have no positive tests in Macon County residents. None whatsoever. And that's good news on one hand. On the other hand, we did have some travelers who came through who were positive that we were involved with. So we've done 56 tests, and we're still waiting for results on some. Last thing I'd like to just point out, we have some information for folks who are interested in finding out if they've been affected by or infected by COVID-19. If they have fever, coughing, difficulty breathing, they can contact us or their local healthcare provider. The call center that takes the number for, or takes the individual's concerns is 828-349-2517. Is for us to get information to our EPI team and to the healthcare providers in our department. If you'd like to speak to somebody in our our call center, we're there Monday through Friday from 8 to 5. If you want to talk to somebody at the state level, 866-462-3821. And I just wanted to show that we've had a good bit of activity going on. The call center was activated on March 12th, and we've received 360 calls to date, well, to the 25th, and they come in every day asking questions about COVID-19. We also would point people to our Facebook page, and that's where we provide a lot of up-to-date information and answer questions on occasion there, but there's a lot of information changing rapidly. The disease is a rapidly changing disease in that it's spreading, and even some younger individuals are starting to show disease. It's mostly concern, though, of those who are 65 and over with underlying health conditions, such as heart disease, lung disease, diabetes, if they have immunocompromised situations. It's also a concern for those folks who are in nursing homes and in some of the assisted living facilities. So we're trying to look at not only protecting the public and those high-risk individuals, but also have to be concerned about the healthcare workers. And that if we have healthcare workers more and more affected and have to be quarantined, that reduces our ability to respond to the surge of individuals that may come in if we don't have limited numbers of folks or stop the number of folks coming in on a regular basis with disease or have been quarantined and are not following the quarantine procedures. So it makes it difficult if our system gets overrun with folks. As I described, the catch basin theory that I like to look at, we don't have a lot of surge capacity in the system to take a great number of folks in without having difficulty responding, and that could put somebody's life at risk. It is my belief that if we don't get some relief with the travel and as well as the individuals coming to our county, that there will be unfortunately deaths that will be occurring in this area, because some folks are that ill, will become that ill, and they may not be able to find health care quick enough, or if we have a run on health care here, they may not be able to get in fast enough to get service. So,
Arlen?
yes.
Mr. Chairman, I did part of a call with Dr. Elizabeth Tilson. She's the Chief Medical Officer at Will County Department of Health and Human Services. It's at 2 o'clock, 636 cases, 57 counties, 50 people are hospitalized. Most of those are in intensive care. The average age in the intensive care is 41 to 50. Those who have passed away in North Carolina, the average age is 40 years old. There've been 15,400 completed tests that are negative. There's over 15,000 tests still pending. So, how long is it taking to get our test results back?
It's several days. My other expert here is Director of Nursing, Jennifer Gary.
So it's taking from the state anywhere between 2 and 3 days, but if we send them to LabCorp, it can take anywhere to 5 to 7 days. It's
Where you
taking
send
quite a
most of
while.
them?
Well, so most of our tests have been going to LabCorp.
Come on up, girl. The radio needs to hear you.
Most of our tests have been going to LabCorp, and the ones that have gone, like I said, have taken anywhere between 5 to 7 days. There's a backlog at LabCorp right now, and they're aware of that. They've been working to get more people there. They thought by Wednesday they would have some of that eased up, and it's not eased up as much as they thought. So they're running tests as fast as they can.
And I take it we're still under the same guidelines to get a test, you're showing symptoms.
So the way you get a test is if you have a fever, lower respiratory symptoms, and a negative flu is what we're using as our criteria. When you call in to be screened with us, we'll go through a screening process. We'll ask you a bunch of questions. It takes a few minutes to get through. And then based on what you give us for symptoms, we run it through our criteria, which is the fever, shortness of breath, lower respiratory issues, and a negative flu test.
And how many tests do we have on hand?
I don't remember when I left
I
today.
think it's over 20 at the last count.
How many, Carmen?
Over 20.
20. We got more orders, of course.
Yeah.
Hunting more all the time.
Hunting.
Hunting is the key
Hunting
one.
is the key.
And we do several tests every day, and have
The testing,
Weeks,
yeah. The testing waxes and wanes. We have days where we have more and days where we have less, but we're testing, we have a test at least every day.
And our department's totally committed to this effort. We're basically just doing COVID-19, and it's a challenge to keep up with everything that's going on. And it's been a long haul, and we believe, at least I believe, that this will not stop anytime soon. I would like to believe it would, but I think we'll be dealing with this long term, which to me will be many months. Could be until we have a vaccine, which is projected anywhere from a year to 18 months from now to have a vaccine. And I believe we'll be involved with that very much so as a public health measure. Once that vaccine's available, we'll probably be doing vaccination clinics or mass distribution of vaccine as a way to stop further spread and to help people hopefully return to a normal.
And there's further evidence this is no respect of persons. Our state treasurer, Dale Fall, is been diagnosed with COVID. He's full blown with it. So now the Treasury Department now, they're gonna pick and choose.
No, anybody can get it, and it's concerning when you have what we thought were younger people would be less affected, but when you just gave them away data, shows that may be shifting. The viruses have been known, especially flu viruses, to mutate. We don't know yet about how this virus is going to act over the long haul. They were told initially that 80% or 81% of the folks who get COVID-19 are it's a mild illness, and then obviously 19 to 20% will have more severe illnesses depending on their health background or condition. So we could be looking at, a good number of folks, if that is not holding true, and it's going throughout the whole population and age ranges as well. So it just depends on your individual circumstances as to whether or not you're more at risk. If you're younger and have those same health conditions, you are at risk. So the best message we can send right now is to stay at home, stay at your home unless you have to go out. And this is not a long-term vacation approach. This is not a long-term blizzard. This is a long-term health illness that is not going away anytime soon. And we can't stress enough, it's serious, it's to be taken serious, and we're putting people's lives at risk, such as law enforcement, EMS, healthcare providers, nurses, doctors, you name it. If people don't take this seriously and stay home and follow the precautions that have been put out by CDC, State Health Department, local health department, their doctors, and so on and so forth, medical community. I can't stress that enough.
Thank you, Brian. Any further questions? Mr. Blackwell?
For the public information, could you just say what your Facebook, name is, like at Macon Public Health?
Yeah.
Well, I think I hear you saying this is updated every day. What we've seen you today pertains to at any moment. But tomorrow morning, if I look at this, tomorrow evening, it may show something different.
Yeah, we update general information. We don't usually get into all the testing numbers on our Facebook, but it is Macon County Public Health.
Macon County.
Public Health is the Facebook name. And people can go there and see what the latest information we are publishing. We've been using Facebook quite a bit and we're getting good response. And we're trying to work with other systems as well, like the school system is sending out informational sheets with the food that's going out to every household, or those households that are receiving food. So information is key. Rumors are rampant, and we need to combat those rumors with facts. So please call us if you're hearing rumors, because this will help to dispel them. Thanks.
So, Carl, one more question.
You got any questions, Paul? You know, I don't have questions.
Okay.
Nobody understands this coronavirus. We've got models, we've got scientists, we've got experts predicting what's going to happen. And I think one of the reasons that we're successful in Macon County, your geographical approach is a good example, but I think people are very conscious. I think personal responsibility has been a great asset in Macon County. Everywhere I go, and I'm out all the time, I'm going. And it's amazing. There's always gonna be that small percentage that, you know, are lame brains. But I think personal responsibility, we ought to credit the citizens of Macon County for the attempts, because it's really affecting our daily lives. Now, state requirements, I just read this quickly. The state requirements, what I'm seeing is hodgepodge approaches in every county, every town. Highlands is shut down. Haywood issued today the stay-at-home shelter in place. They've identified essential and non-essential services in the private sector. There needs to be, it looks to me like some uniform approach to this thing. Now, the governor, I think, has issued that hotels are essential services.
Depends on if they're housing, say for example, medical providers who are coming into an area to help out, emergency personnel. I think in some cases where you might have construction going on, but by and large it's for, I think, those who are responding to the COVID-19 outbreak.
But there's been no blanket shutdown of motels across the state, is that right?
To some extent, they've been shut down. You're looking at Airbnbs, RV parks, things of that nature too. So there are a number of places that are being shut down. It's more to focus in on people, for example, who are homeless or need some place to stay temporarily in an emergency situation. We have that going on in our county too, where there are homeless individuals who need to be put somewhere temporarily if they're quarantined or isolated and don't have some place to go.
Okay. And then the mass gatherings, I think the state's still at 100,
They dropped it to 50.
dropped it to 50.
That's correct.
So why are what is our science to say we're gonna do that to 10?
Well, I don't think there's as much science to the 50 or 100 that I'm aware of, and the 10 was recommended actually by CDC now. So I think once we see CDC adopting that, the science is more likely to have been applied in that number. And of course, it's exponential, so the more people you have, the more risk you have. So if we can reduce the number of people, we reduce the risk. That's the way I think we're looking at the scientific basis of why we do what we do.
And this is a serious thing, coronavirus, 1,000 deaths national. I just checked the CDC numbers on the flu. As through October 14th, it was 23 to 59,000 seasonal flu deaths. I'm comparing the two, but we deal with viruses. Coronavirus will be a seasonal virus in the future. more than likely, or maybe not too distant future. The thing that concerns me, and I appreciate your approach from a safety and health standpoint, but from an economic standpoint, and hopefully y'all are figuring that in, because tomorrow, 3.2 million new people in the United States will be getting a paycheck. Won't be getting a paycheck next week probably if they file for unemployment. Hopefully this stimulus bill will get to them sometime. And I work with a lot of people in the private sector, go from week to week. Everybody here, you pay private people $10,000 a year or $50,000 a year, they're gonna spend it. That's what it's for. So this is having a major economic impact. And we've had one state of emergency, now we're going to amend it to tighten it a little bit more. What is the long-range plan? You were saying this thing could go for 2 years, or 3 years. How are we factoring in the economic impact and comparing that to the health issues? This economy can't be shut down for months.
Well, let me see if I can address that. If, in looking at spiking the disease, the rapid increase can put us at risk of our healthcare system failing. If the healthcare system fails, then the economics of it will be even more drastic in that people will not be able to recover even at any point because they have no healthcare system intact yet to help them, especially those that are the most severely ill. So the reason we're doing the activities now, social distancing, hand washing, and so on, is to reduce the peak and to flatten it out. You've heard many times, flatten the curve. It's to extend it instead of surging it. So if you're surging it, what you're doing is you're putting extreme stress on in a short period of time instead of spreading it out. People are gonna get sick either way, but if you don't have a surge and a spike, it won't overwhelm the system, and that will have an economic impact not only in the healthcare system, because you'll lose staff, you'll lose the ability to maintain a ongoing response. What that also does is your community then has no place to go. It can continue to spread out into the community, which means more and more people are affected. They can't go to work, the healthcare system can't perform. So now we've got even fewer people able to respond, and it will continue to grow. As it grows, we don't know whether it will increase and at a point and then stop and start to go down like the flu does. We at this